Hello, everybody. My name is Alejandro Morales. I will be your host today, and welcome to the podcast. Today, we're going to be talking about national class standards, health disparity of my choice, which is life expectancy, between the black community versus the white community, and which standard I think we need to emphasize more to solve this disparity. Let's talk about the national class standards. First of all, interesting fact. In 1966, Martin Luther King Jr. stated, "Of all forms of inequality of healthcare is the most inhumane." What does this mean to me? This means back in that time, the black community was facing inequality of healthcare, which lowered their life expectancy in comparison to the white community. Sadly, we are still seeing this disparity at this time. But the national class standards. The U.S. Department of Health and Human Services came up with the national class standards, which means class stands for cultures and linguistically appropriate service standards. And we have these standards to ensure everyone receives effective health care that meets the individual's cultural belief and language. First, before we get into it, there are 4 phases of the national class standards. Indication and engagement and assessment, which means to go out to these communities and assess what they need to have better health care. Then we have implementation and sustainability, which means after gathering these data to find a solution and implement these solutions in these communities and seeing if they work. So why do we have national class standards? We have these standards to make sure that communities and individuals have the proper health care they need based off their cultural belief and language. How many standards are there? There are 15 standards that are divided into different categories. National Class Standard 1 falls into Principle of Standards. National Class Standard 2 to 4 fall under Governance, Leadership, and Workforce. National Class Standard 5 through 8 fall under Communication and Language Access. And National Class 9 through 15 fall under Engagement, Continuous Improvement, and Accountability. Now, we have an understanding of the national class standards. Let's go into our health disparity. We're going to be talking about life expectancy, specifically the black community versus the white community. Did you know in the 20th century, there used to be a 14-year gap between black Americans versus white Americans? Over time, the gap decreased to 4 years, but there is still a disparity when it comes to life expectancy. What is driving the racial disparity in life expectancy? Well, it comes to health disparities that are driven by the social economic inequalities. What is that, you ask? Well, we are seeing an increase in economic stability, education, food access, and healthcare access to the healthcare system, an increase in these resources in the white community. And we are seeing a lower access to these resources in the black community. Is this driven by racism? Who knows? But research does show that the black communities are more likely to be uninsured in comparison to the white people in the white community to be insured. And what does this mean? Well, research shows that uninsured people have a higher mortality rate and lower survival rate than people with insurance. And where are we seeing these? We are seeing these in the black communities. Also, research shows racism and discrimination driving racial disparities in mortality. Research shows that 1 in 5 black people have experienced racism in the healthcare system, which is driving them away from becoming insured in the health system. Another piece of evidence is that we are seeing underlying social and economic inequalities that also drive disparities in mortality rates. The black communities are more likely to have lower income housing and education access in comparison to the white communities. In these communities, we are seeing higher incomes and more education, which leads into a longer life expectancy. Another piece of evidence is that social and economic factors can also shape the health behaviors and exposure to health risk and influence life expectancy. In the black community, we are seeing an increase in smoking, substance, and alcohol use and disorders and obesity compared to the white communities. Research suggests that eliminating these disparities, such as smoking and obesity, would greatly narrow the disparities in life expectancies between black and white people. Also, in the black community, we are seeing an increase in violence, police violence, and gun-related violence between each other. In the white community, we don't see this very often. So what does this mean? In the black communities, we are seeing racism in healthcare. We are seeing uninsured people. We are seeing behaviors that decrease the life expectancy, such as smoking, gun violence, alcohol and disorders, and obesity. We're seeing more of this in comparison to the white communities. So the national class standard that I think that needs to be implemented more to solve this issue is National Class 15, which is communicate the organization progress in implementing sustaining class to all stakeholders and constituents and general public. Well, there used to be a 14-year gap in between the black community and the white community, but according to data, this national class standard would improve decrease that 14-year gap to a 4-year gap was improve access to healthcare and economic status, and health professionals going out there and engaging with the community. And that's what we need to see more. So that's why I believe National Class Standard 15, which is community engagement and performance evaluation, is important, and we need to see more of this so we can see more people in the black community insured. We can see more access to healthcare, and overall, we will see the life expectancy rate to narrow down, and we'll see a similar rate. Thank you, everybody, and this concludes my podcast.